Hi guys, this is Julie Gold. I'm the clinical supervisor for the central team, and I've been asked today to talk to you about how and why I decided to get my COVID vaccine. So I have to admit, I was very reluctant at first. Being a nurse and seeing side effects of medication, I just wasn't, fully drawn to the idea of injecting something in my body that is so new. So I kind of hemmed and hawed, and then I actually ran into Teresa Santoro, who was going to get her vaccine, and she kind of changed my mind. And that same day, I went to Carrie Lenardi, who kind of gave me, the pros of the vaccine. So after taking deep breaths, I signed up. And I'm actually very glad that I did, because in between both my vaccines, I did get COVID. And I think one of the reasons why I didn't get it so bad is because of the vaccine. I am currently vaccinated and I feel great. I feel a little bit more liberated. I'm still doing the precautions on everything, but I had mild side effects from the injection, and I recommend it because, we have to start getting our world back to the way it was. It's hard living this way. So I challenge everybody to get their vaccine and get us back to regular living.
Hi guys, for those who might not know me, I'm Erica Elmsley. I work in HR with Kelly Klein, and I'm here to talk to you about my COVID-19 vaccination story. So for those who don't know me very well, I take a very holistic approach to my health. My primary doctor is a naturopathic doctor. I'm very wary of anything that I put into my body, whether it be food, medicine, vaccinations. I always like to know all the ingredients, like to know where it came from, all that good stuff. So when it came time to think about the COVID vaccination and getting the vaccine, I was very weary. I felt like it was produced really quickly. I felt like I didn't have a good grasp of the ingredients or what was in it. And I also was weary of the long-term effects. What is this going to do to my body in 6 months from now? And so I really thought I was not going to get it when it was offered to me. I felt I'm going to wait it out, maybe a year, see how it's doing for other populations, and then, decide. But then at the same time, I was also really nervous, and even maybe more so, about getting sick and getting COVID-19. I've done a lot of research about those who, are my age and did get sick, hardly had any symptoms, and now they call them long haulers because they used to be active and aren't active anymore. And that's something that's really important to me too. And I was also worried about the long-term effects of what happens if I get sick, and in a year from now, could I have complications? So I kept going back and forth, trying to decide what should I be doing? Should I be getting the vaccine or not? And it came time that I was eligible through RVNAhealth. And so ultimately I called my doctor, and as a naturopath, she did tell me that the naturopathic world is very divided, but she felt it was not only her duty to get it, but she also put a good perspective for me. She said, look, are you willing to get the vaccine or get COVID-19? Because odds are one is going to happen. And when she said that, I realized I don't want to get sick. I don't want to get the virus. I'd rather get vaccinated. So with her help and with putting that in perspective and doing a little more research, realizing that even though it was produced quickly, that they still took all the right steps. And I realized that this is the step I want to take. So I did get both shots. I got the Moderna. I wasn't very sick after my first one. I did have a little bit of achiness. But after my second one, I did have some symptoms. I had a fever, body aches, headache. Definitely was sick for about 24 hours or so. But I would say that those 24 hours were worth the peace of mind I have now. I still take the same precautions I did before I was vaccinated. I actually double mask when I'm out in public. And I really did that not only for my own health, but because I live with someone who's not vaccinated yet, and I want to make sure that their health is just as important to me. So I make sure I take all the right precautions. I still, wear a mask. I always wash my hands, but I make sure if if I ever touch any surfaces, hand sanitizer, all that good stuff. But I feel that it was the right decision, especially now with new strains coming out. And I knew that being sick would make me more nervous. So ultimately, this is, I feel good about my decision. I feel happy. I feel healthy. And I'm more than happy to talk to anyone if they have more of a holistic approach as well and are nervous, or if they just want to learn more about my outlook and about my reasons as to why I made this decision. But I am hopeful that the more that people that get vaccinated, the sooner we can be inside with our loved ones and hug people again and all that good stuff. So I'm very happy with my decision and I feel good about it. But I'm more than happy to talk to anyone who might be on the fence or might just want to hear more about my experience. But thank you so much for listening.
Hey, what's up, family? This is Maceo Baker, an employee at RVNAhealth. I am a certified hospice aide. And I just wanted to kind of just share my story about the pandemic and the vaccination. I was really afraid when it first came around. There's a lot of misinformation. It was so new, we really didn't know what to expect. And then when they came out with, with the statistics as far as like African Americans, Black and brown communities being infected and dying at, more rates, alarming rates, I was really concerned. And then, comes to talk of the vaccine, and already skeptical of the vaccine because of historical reasons in the Black and brown communities. So I really wasn't going to get the vaccination. But then, hearing about the underlying conditions, the hypertension and things of that nature, which I do have some of those underlying conditions, it made me think a little bit different about it. And so eventually I got it, with talking with my mother, my family, and some close friends. They really wanted me to do it. And, just the more I thought about it, the more it made sense. I'm grateful for the opportunity to have been vaccinated. It was okay experience, but I'm happy that I did it. And once again, my name is Maceo Baker, hospice aide, RVNAhealth. I encourage my friends, partners, anybody else that hasn't got the vaccination to please consider it. Thank you.
Hi, my name is Trisha Nelson. I'm with the marketing department. I got my final dose of the COVID vaccine around mid-February. I was really excited to get the vaccine, particularly after Dr. Hale's employee presentation that she did around the vaccine in January. I have asthma, and I also have older parents that I really miss and enjoy visiting. And so for both of those reasons, I really had been nervous about the virus and looked forward to the vaccine. In the past month, since all of that, I've had the opportunity to really test out the effectiveness of the vaccine. At the end of February, just 2 weeks past my final dose, my daughter was exposed to the virus. And just a few days following that, she developed symptoms and was diagnosed. And then just a few additional days beyond that, my other daughter and my husband were also diagnosed. I never developed symptoms throughout that sort of 3-week period of quarantine that my family went through. I came into RVNAhealth, or stayed outside for weekly testing, and those results always came back negative. While my kids fared pretty well through the virus, unfortunately, my husband got pretty sick, was diagnosed with pneumonia and had to seek medical help. So through all of that, everyone's recovered now, but, I really consider myself extremely fortunate to be vaccinated. It not only protected myself, but I was able to care for my loved ones, and I feel like I'm living proof of its effectiveness. So thank you to RVNAhealth.
Hello, I'm Paula Schlemmer. I just wanted to let you know that I did receive the vaccine. I am very happy I went and received it. In the beginning, I was dead set against receiving it when we first heard that we can get it here at RVNA. But after speaking to my husband and daughters, they pushed me to get the vaccine. I did have the side effects for the second vaccine, but in the end, everything that I went through is well worth it, because now I am protected and vaccinated and not able to spread the virus to others. I do push all my family and friends towards getting the vaccine. I can't make them do it, but I'm pushing them to do it.
Hi, I'm Kyla from RVNAhealth. I had gotten the shots. I received both of my vaccines, and I was hesitant at first to get it, but I decided to get it even though I did have COVID in October. I still decided to get it because I did hear that you're not going to be able to travel without getting the vaccine, so I just thought rather I'd be safer than sorry. But I don't get the flu shot, so I don't know if this is going to be an annual thing like the flu shot. I don't know if they made that decision yet, but that's why I got the shot.
Okay, Mom. So I heard you got the vaccine. How did you feel before it?
I mean, I think like everybody else, I was a little bit nervous. But I did a lot of research, and I made sure that when I was researching that I was using respectable research, outlets that I trusted, people that I trusted, to help me make the best decision for myself and for my family.
Oh, so is that what motivated you?
My family? Yes. Good catch. I think the thought of keeping, my mom safe, your grandmother safe, both your grandmothers safe and your grandfather safe were a big part of what motivated me. And I think just getting back to normal life and seeing a light at the end of the tunnel was inspiring enough to do it.
So how was the experience?
Not bad at all. I know that there are side effects. I know that people have varying degrees of side effects. Mine were minimal, slight headache, fatigue, and that was it. Well worth doing.
Okay. Thank you.